In 2019, a woman named Alexa Kasdan went to a doctor in New York for a routine sore throat. The visit took 15 minutes. 2 weeks later, she received a bill. $28,000 for a throat swab. She had insurance. Her insurer paid most of it. The doctor's office eventually waived what remained. She walked away owing nothing, but only because of luck and forgiveness, not because the system protected her. She was not unlucky. She was not unusual. She was the American healthcare system working exactly as designed. The United States spends over $4.5 trillion on healthcare every year, nearly $15,000 per person, more than twice what Germany spends, more than 3 times what the UK spends. Both of those countries cover every citizen. The US does not. And by the measure that actually matters, how long people live, Americans have a lower life expectancy than citizens of around 50 other countries, including Cuba. Cuba, which spends a fraction of what the US spends per person, now outlives the average American by nearly 3 years. The United States spends the most, lives the shortest. That is not a paradox. It is a mechanism. The question is, who built it, and why it has never been fixed? Here is something almost no American knows. The exact same MRI scan, same hospital, same machine, same radiologist, same 20 minutes, can have 3 completely different prices, depending on who is paying. A patient with Blue Cross insurance, $400. A patient with United Healthcare, $1,800. An uninsured patient, $5,000. Same machine, same hospital, 3 prices. This is not an error. It is the negotiated rate system, a pricing architecture that exists in no other country on Earth. This fragmented pricing exists because there is no single price for anything in the US healthcare system. 900 different insurance plans, each negotiating separately with thousands of hospitals and clinics. The administrative cost of managing this fragmentation is staggering. Peer-reviewed research puts billing and insurance-related costs at over $470 billion per year, more than what many countries spend on their entire healthcare systems, spent entirely on paperwork. Canada runs a single-payer system. Administrative costs, 12% of total spending. The United States, 34%. That gap represents roughly $1 trillion per year spent on billing rather than patients. $1 trillion per year on administration. Not treatment, not medicine, not care. The question is not whether this is inefficient. The question is who receives that $1 trillion and whether they have any interest in efficiency. Here is the fact that citizens of other countries genuinely cannot process when you explain it to them. In the United States, medical bills are the leading cause of personal bankruptcy. Not job loss, not divorce, not a failed business. Medical bills. 530,000 American families file for bankruptcy every year, primarily because of healthcare costs. According to a study published in the American Journal of Public Health, Germany, 0. United Kingdom, 0. Canada, 0. Australia, 0. France, 0. Medical bankruptcy is not a global phenomenon. It is an exclusively American one. 530,000 families every year in a country that spends more on healthcare than any nation in history. The bankruptcy is not the anomaly. The bankruptcy is the product. In 2020, the CEO of HCA Healthcare, the largest hospital chain in the United States, operating over 180 hospitals, earned $30 million in total compensation. That same company has repeatedly sent over 1 million patient accounts per year to debt collection agencies for unpaid medical bills. Same company, same period. Patients in collections. $30 million to one executive. Both figures come from HCA's own financial disclosures and SEC filings. 1 million patients sent to collections. $30 million to one executive. These numbers exist in the same annual report filed with the same government that was legally prohibited from negotiating drug prices on behalf of those patients. The second major cost driver is pharmaceutical pricing. The United States pays more for prescription drugs than any country on earth, for the same drugs, from the same manufacturers. Ozempic, you've heard of it, the diabetes and weight loss medication that has dominated headlines for 2 years. According to the Peterson KFF Health System Tracker, in Germany, $59 per month. In Canada, $155. In the United Kingdom, $93. In the United States, without insurance, $969 per month. Same molecule, same manufacturing plant, different country, different price. The manufacturer adjusts its price to whatever each market's negotiating power allows. For 20 years, the U.S. government was legally prohibited from negotiating on behalf of its Medicare patients. That prohibition was written into the Medicare Modernization Act of 2003, a law the pharmaceutical industry had a major hand in drafting. According to Health Affairs, a law written by the industry it was meant to regulate, prohibiting the government from negotiating on behalf of its own citizens for 20 years. The question is not how this happened. The question is why it was allowed to continue for as long as it did. None of what you have just heard is a malfunction. The pharmaceutical company charging $969 for Ozempic is doing what its shareholders expect. The insurance company, with hundreds of billions in administrative overhead, is navigating the system it operates within. The hospital CEO, earning $30 million, is being compensated according to a market that values his role. The patients in collections, the families in bankruptcy, the woman with the $28,000 throat swab bill. They are the friction in a system optimized for something other than their health. The system is not broken. It is working, exactly as it was built to work. Every country that provides universal healthcare coverage spends less per person than the United States. Every single one. The arithmetic is not disputed. The choice to maintain the current system, with its bankruptcies, its negotiated rate chaos, its administrative overhead, is exactly that, a choice, made repeatedly by a political system that receives significant funding from the industries that benefit from it. Whether that changes is a question for voters. The data that should inform that decision has been in front of everyone for decades. This video is part of that data. Every wealthy nation has looked at this system and built something different. The United States has the data. It has the examples. It has the economic means. Whether it will is not an economic question. Systems explained honestly. Subscribe if that matters.